Adult CPR. The new protocol of CPR in adults has been changed from ABC to CAB protocol. In previous guidelines, CPR in adults was mainly focused on one rescuer CPR. However, modern guidelines prefer two rescuer CPR in adults and suggest that better results can be achieved as teamwork in adult CPR. Adult CPR is a multitasking procedure, involved multiple tasks performed simultaneously. These may include chest compressions, airway management, delivery of rescue breaths, and application of automated external defibrillator, AED. Performing these multiple tasks simultaneously as a team can save valuable time in order to minimize or prevent the damage to the heart, brain and other vital organs. The detailed procedure for adult CPR can be discussed as 1. 1 rescuer adult CPR, 2 rescuer adult CPR, 3. Adult mouth-to-mask ventilation for 1 rescuer CPR, 4. Adult bag mask ventilation for 2 rescuer CPR, 5. Application of automated external defibrillator, AED. 2.11 Rescuer CPR for adults. If CPR is performed by a single rescuer, it is called as 1 rescuer CPR. 1 rescuer CPR for adults include following steps. A. Scene safety assessment. Stay safe both rescuer and victim. If you encounter an individual who may need CPR, first of all look around and ensure that you and the victim both are in a safe place. For example, if you find a victim who is in water or on a road, first of all try to move the victim to a safer area. If you and victim both are already in a safe area, then do not move the victim as he or she may have other injuries like head or neck injuries that you cannot see. The simple approach for initial scene safety assessment is the mnemonic SAFE, S, stop, always stop at the scene and think for how to act or respond. A. Assess, make an initial assessment about safe approach to handle the victim, scene safety, ventilation assessment, and assessment for other hazards. F. Find, try to find the first aid kit, AED unit, and oxygen if possible. Remember, don't wait for these equipments. Always start chest compressions as soon as possible. E. Exposure protection, always try to use barriers such as gloves and mouth-to-mask devices to prevent the spread of infections. B. Initial assessment of the victim, state your name and desire to help loudly. Shake the victim and say or shout, "Are you okay?" If the victim responds, then try to assess what is wrong. If the victim does not respond, turn the victim on his/her back and assess for normal breathing. If he or she is not breathing normally or only gasping, you must start compressions and summon help. C. Activate the EMS and find an AED, shout for help. If someone in surrounding responds, then ask him/her to call for help by dialing 911. In certain circumstances, if you are in a place where an automated external defibrillator, AED, is available, ask the responders to go for the AED. Also tell the responding person to return as soon as possible for your assistance. If you are alone and nobody is in surrounding, immediately call for help by dialing 911 and run quickly to get the AED if you know where one is nearby. If you do not know or find an AED, start CPR immediately after calling for EMS. D. Steps for 1 rescuer CPR in adults. Palpate a pulse on the side of the neck for at least 5 seconds but not more than 10 seconds. In adults, most commonly it is carotid pulse that is assessed. To feel for a carotid pulse, slide your 2 or 3 fingers into the deep groove between the neck muscles and the windpipe at the side of the neck and feel it. If there is no pulse found or you are not sure if there is a pulse, initiate CPR immediately with chest compressions. Deliver 30 chest compressions, followed by 2 breaths. If you are reluctant to give rescue breathing and or you do not have a mask available, you can do compression-only CPR. Use the heel of your one hand on the lower half of the sternum in the center of the chest and put your other hand on top of the first hand. Always straighten your arms and press them straight down. Remember to push hard and fast. Compressions should be between 2 to 2.4 inches into the victim's chest with a rate of 100 to 120 compressions per minute. Make sure that between each compression you should completely stop chest compressions and allow the chest wall to return to its natural position for proper refilling of the heart with the blood. After 30 compressions, chest compressions should be stopped and open the airway by head tilt/chin lift maneuver. For this maneuver, put your hand on the victim's forehead and tilt his/her head back. Lift the victim's jaw by placing your index and middle fingers on the lower jaw to lift it up. Remember that never perform the head tilt/chin lift maneuver if you feel or in doubt that victim may have a neck injury. In the cases where you suspect a neck injury, the jaw thrust is an ideal method to use for airway clearance. For the jaw thrust maneuver, grip firmly the angles of the lower jaw and lift it up with your both hands, one on each side to move the jaw forward. Give a breath and watch the chest rise of the victim. Repeat, giving a second breath. Breaths should be over 1 second. After completing the cycle, initiate another cycle of chest compressions. Keep in mind, push hard and fast rule. Compressions should be between 2 to 2.4 inches into the victim's chest with a rate of 100 to 120 compressions per minute. Alternate chest compressions, 30, and giving breaths, 2, until advanced medical support becomes available. Defibrillation. Attach the automated external defibrillator, AED, if available and disrupt the chest compressions. 2.22 Rescuer CPR for adults. If CPR is performed by 2 rescuers, it is called as 2 Rescuer CPR. 2 Rescuer CPR for adults include following steps. A. Scene safety assessment. Stay safe both rescuer and victim. The simple approach for initial scene safety assessment is the mnemonic SAFE. S. Stop. Always stop at the scene and think for how to act or respond. A. Assess. Make an initial assessment about safe approach to handle the victim, scene safety, ventilation assessment, and assessment for other hazards. F. Find. Try to find the first aid kit, AED unit, and oxygen if possible. Remember, don't wait for these equipments. Always start chest compressions as soon as possible. E. Exposure protection. Always try to use barriers such as gloves and mouth-to-mask devices to prevent the spread of infections. B. Initial assessment of the victim. State your name and desire to help loudly. Shake the victim and say or shout, "Are you okay?" If the victim responds, then try to assess what is wrong. If the victim does not respond, turn the victim on his/her back and assess for normal breathing. If he or she is not breathing normally or only gasping, you must start compressions and summon help. C. Activate the EMS and find an AED. In 2 Rescuer CPR for adults, direct the second rescuer to call 911 while you initiate the CPR. This second rescuer can also be directed to find an AED while you keep on doing CPR with victim shout for help. D. Steps for 2 Rescuer CPR in adults. CPR tasks should be shared between 2 rescuers and 2 Rescuer CPR as you should continue chest compressions with counting the compressions loud each time you compress the victim's chest. The second rescuer should keep the victim's airway open through the head tilt chin lift maneuver. It is also the responsibility of the second rescuer to give 2 rescue breaths after every 30 compressions, using a face mask or a bag mask device. Always switch your positions and roles about every 2 minutes with second rescuer so neither one of you gets tired. 2 minutes means about 5 cycles of 30 compressions and 2 breaths. However, you may change positions sooner if the other rescuer doing compressions becomes too much tired to perform high-quality compressions. In case where AED is found or becomes available during the CPR, the second rescuer should power on the AED and attach the pads to the chest of the victim. You should continue CPR without any interruption while the pads are being placed. The second rescuer clears the victim and pushes the Analyze button when indicated by the AED to do so. The second rescuer should also push the shock button if a shock is indicated. If no shock is needed, or after the victim has been shocked, the second rescuer should take position to resume the chest compressions, as you may be fatigued by this time, while you should manage the victim's airway and deliver breaths using the bag mask device or face mask. After approximately 2 minutes, or 5 cycles of CPR, the AED will indicate that the victim's rhythm should be analyzed. CPR along with proper analysis for AED should continue until the person stables or EMS becomes available. 2.3 Adult mouth-to-mask ventilation for 1 Rescuer CPR. Face mask is a great source for exposure protection which provides a barrier between the rescuer and the victim. There are different varieties of masks available in the market. Some masks are equipped with a one-way valve that permit the rescuer's breaths to enter the victim's airway and prevent the victim's exhaled air from entering the rescuer's airway. These masks also protect from vomitus and blood of the victim, which may be an infection risk to the rescuer. However, it usually requires practice to learn how to use these masks sufficiently to provide proper ventilations. In 1 Rescuer CPR, always try to supply the breaths using a pocket mask, if available, through following steps. Adjust your position in such a way that you face the victim's side. Positioning yourself at the victim's side will enable you to provide both ventilations and compressions effectively, even without having to move. Position the mask properly on the victim's face in such a way that pointy end of the mask should be placed over the bridge of the victim's nose. Seal the mask opposite to the victim's face. To do this, Place your four fingers of one hand across the top of the mask and the thumb of the other hand along the bottom edge of the mask. Use the fingers of your hand on the bottom of the mask, and open the airway by using the head tilt/chin lift procedure. Remember, do not perform this if you suspect the person may have a neck injury. Deliver air through breath over 1 second, while ensuring that the victim's chest rises. If the victim's chest is not rising, then reposition the mask and again try to get a better seal. Always keep in mind that you should be lifting the victim's jaw into the mask, instead of simply pushing the mask down onto the victim's face. Dispense 2 ventilations over 1 second, each with the mask, after every 30 compressions. If the victim has a prominent pulse but is not normally breathing, move towards rescue breathing by providing one breath every 5 to 6 seconds, 10 to 12 breaths per minute. Always check victim's pulse regularly after every 2 minutes. If there is no pulse found, start chest compressions along with ventilations at a rate of 30 to 2. Remember, practice using the bag valve mask as much as you can. It is essential in formation of a tight seal to deliver effective breaths. 2.4 Adult Bag Mask Ventilation for 2 Rescuer CPR. It is a technique in which a device, bag mask, is used to assist artificial breathing. Bag mask device consists of a bag which is attached to the face mask. It is readily available in hospital settings. Bag mask ventilation is recommended for 2 Rescuer CPR. The use of bag mask ventilation is difficult. It requires proper training and practice before it can be applied on a victim. In this technique, the initial step is to choose the mask that will properly cover the victim's mouth and nose. The victim's face should be pulled up into the mask in order to achieve best results. After selecting and fixing the mask with the victim's face, the next step is to attach the mask with a bag device, which should be attached to high-flow oxygen, i.e. 15 liters per minute. Make sure that the bag should be fully inflated. Apply the head tilt-chin lift maneuver to open the airway and give 2 breaths, 1 second each. Always be sure to watch for the fall and rise of the chest between breaths. If the victim's chest does not fall and rise between each breath, then move towards the assessment for obstruction. Always be sure that there should be a tight seal to the face along with cleared airway, no airway obstruction. Adult bag mask ventilation can be summarized as: adjust yourself at the top of the victim's head to make room for the second rescuer to provide compressions. Adjust the mask of the bag mask device on the victim's face by using the nasal bridge of the victim as a guide to correct positioning. The second rescuer should use the EC clamp technique to hold the mask in the correct position while the jaw is lifted to obtain an open airway. To do so, he or she should take the index finger and thumb of his/her one hand, non-dominant hand, and join them into a C around the top of the mask. His/her other fingers of the same non-dominant hand should be used to lift the jaw, thus form the E part of the EC clamp technique. The bag should be squeezed to deliver a breath. Each breath should be delivered over 1 second. Watch for chest rise. If it is not occurring, you do not have a tight seal. Reposition the mask properly and try again. The second rescuer should also supply 2 ventilations after every 30 compressions. If the patient has a prominent pulse but is not normally breathing, provide 1 breath every 5 to 6 seconds, 10 to 12 breaths/minute, and check the pulse regularly for every 2 minutes until the victim stables. 2.5 Automated External Defibrillator, AED. An automated external defibrillator is a device that is capable to detect and treat the fatal arrhythmias such as ventricular fibrillation and ventricular tachycardia. These irregular rhythms are a common cause of sudden cardiac arrest. Ventricular fibrillation is a condition caused by disorganized electrical activity in the main pumping chambers of the heart. It is treated with defibrillation or the delivery of an electric shock to the heart through the victim's chest wall. The automated external defibrillator, AED, recognizes ventricular fibrillation and other rhythmic irregularities of the heart, and delivers an electric shock at the right time. The AED has now become a common tool for general public in public buildings. It is safe to use for anyone. It should be ideally applied using the teamwork concept. One rescuer should immediately coordinate with all available rescuers so that he or she performs chest compressions without any interruption while the second rescuer prepares the AED for use. Although there are many different types of AEDs are available in the market, however all are utilized in a similar way. Always make sure to move the victim and yourself to a safe place before using the AED. You should know that electricity and water can be lethal when combined. Thus, ensure that the victim is not wet, quickly wipe dry, or in close contact of water before application of the AED. For victims with attached medication patches, remove the patch, then wipe the skin dry, and finally apply the AED pad. Steps for application of AED. Turn on the machine. This is the most important initial step, as turning the machine on will enable the AED unit to move forward through the next steps. For turning on the AED, open the top of the carrying case and push the button on. However, it should be remembered that some models of AED in the market will turn on automatically when you open the lid of the carrying case. Proper exposure of the victim's chest. If it is wet, dry the victim's chest. Shave excessive hair, if possible. Remove all the medication patches for proper exposure of the chest. Attach the AED pads. Use adult pads for those victims who are 8 years of age or older. Peel off the firm adhesive backing. Insert one pad on the upper right side of the chest just below the collarbone. Insert the other pad on the victim's lower left ribcage, which is just a couple of centimeters beneath the armpit. Some pads are already marked with a red heart on the pad that indicates that it has to be placed on the victim's left side of the heart. Press pads firmly onto the victim's chest and attach the connecting cables to the AED unit. It should be remembered that some cables are already pre-connected. However, make sure that the wires are attached to the AED box. Analyze the rhythm on AED. When the AED unit indicates to clear the victim while the machine is analyzing the victim's heart rhythm, it means you should make sure that no one, including yourself, is touching the victim. At this point of time, the rescuer who is performing chest compressions or supplying breaths will have to stop. Some AED machines available in the market have inbuilt analyzer component that analyze the victim's rhythm independently. For others, you will have to push the analyze button. Analysis of the victim's rhythm usually takes up to 10 seconds, so don't be alarmed by this. Check electrodes. Let AED to analyze the victim's rhythm. If AED message display as check electrodes, then make sure electrodes have good contact with the chest. If the victim's chest is hairy, pull off pad and replace it. Push to shock if a shock is recommended. The AED machine will clearly display shock advised, stand clear. You need to look around and make sure that no one is touching the victim's body, including yourself. Once you are 100% sure that no one is touching the victim, ultimately push the button of shock. You will observe the strong contraction of victim's muscles. If shock is not necessary, if a shock is not necessary, as in the cases where the rhythm is not ventricular fibrillation or ventricular tachycardia, the AED will display the message of no shock advised and guide you to resume CPR. Repeat the analysis after 2 minutes of CPR, or almost 5 cycles of compressions and ventilations. The AED will guide you to repeat the analysis of the rhythm and push to shock. The AED machine instruct you to do so. Continue CPR, continue CPR alternating with analysis of the rhythm. Push the shock button if AED machine instructs you to do so. Continue CPR until advanced life support becomes available.